This is the MyHeart.net podcast. This show is produced by Dr. Philip Johnson in conjunction with VitalEngine.com. Please welcome your host, Dr. Alain Bouchard, of Cardiology Specialist of Birmingham, Alabama, at St. Vincent's Medical Center, part of Ascension.
So welcome to our podcast on the arts and health. And with us today, we have Dr. Julian Owens, who is the executive director of Here's to Life, basically since 1999. He's earned a PhD at the University of South Carolina, and he did his postdoctoral training in mental health as a fellow at the Bloomberg School of Public Health at Johns Hopkins University. He's earned also an MPH at the University of Michigan. And we're here today to talk about one of his really favorite subjects, which is arts and health. So, Julian, thank you very much for taking the time and being part of this podcast for MyHeart.net.
Thank you. Thank you so much for inviting me. Looking forward to sharing with this audience about arts and health, arts and public health, and actually where it all sort of began, which is arts and medicine.
Very good. So, Julian, maybe if you could start by defining what is arts and health.
Well, I think we can probably go with it's a diverse and multidisciplinary approach. And generally speaking, it's dedicated to improving health through the arts. So it's very much what it sounds like. And then to go a little bit deeper, the field sort of integrates all of the arts, visual arts, performing arts, even media arts. And in sort of integrating them toward the goal of improving health outcomes. But I sort of have expanded that definition to also include promoting hope and healing in times like these.
Very good. So, when I went to medicine, very early on, even in high school, you almost had to decide which way do you want to kind of direct, your studies, whether you go to art or whether you go to science, in medicine. How did you come about to get involved in arts and health?
It's interesting you should ask that question because I too was drawn to medicine early on in my academic journey. But I always had a penchant for the arts. I went to a performing arts or school for the arts as a middle school student and continued that throughout my high school journey. I wasn't really that interested in the sciences, but I had to travel through the sciences to get into the pre-med curriculum and ultimately be in a position to apply to medical school, which I did. I ended up going to public health, though, as sort of a stepping stone, which is not uncommon for folks who sort of want to diversify their application. So I went into public health, and that's where I discovered that the real difference between these two fields is medicine is a per person experience. Some portion of medicine may be devoted to prevention, but primarily is treatment and management. Whereas public health is very much focused on populations and very much focused on prevention. So based on the experiences I had early on at NIH in the early 90s, actually, I decided that what I cared the most about was trying to impart lessons learned around preventing illness to populations and to do so in a setting that I'd be able to reach more than one person at a time. So I ended up, going to Michigan and getting the MPH and going back to work at NIH and all of that. But what I also noticed as I was traveling around the world and doing consulting as part of my early career, that music and media in particular in the late 90s was taking on a really interesting kind of energy. It felt as if what had been sort of almost capped on some level, that is all this sort of drug, sex, and rock and roll stuff that's always been a part of popular music. It felt like that had just gotten to a level um, in the spirit of everyone saying whatever they wanted to say and artistic creation and creative license and all of it. It felt as if what was happening is we were actually starting to cultivate conduct and behavior that was the antithesis to health. And I felt like, well, that isn't a good thing, particularly for a developing brain, and for young people who may themselves already be predisposed based on all sorts of disparities to go in certain directions. So I felt a calling, actually, Alan. I felt a calling to connect my background in music, as a performer and songwriter, and my interest in public health and in credentials to do so. And I created a program called Music's Energy. And that program went on to become the subject of my dissertation, the subject of my postdoc work, lots of publications. And what it allows me to do is to connect the dots of the things I care about, the people that I feel are the most vulnerable, which are young people, and those who find themselves at the margins and intersection of disparity based on race and class, and doing a type of work that's fun, that's engaging for everybody, and that actually does leave a mark, I hope, in terms of a legacy of lifelong learning and inspiring people to be their best version of themselves.
Well, sounds good, Julian. People are wondering though, what is art, doing in health? I mean, can you heal through art, and particularly with arts in public health, can you actually prevent disease? So give us some example of some of the work that is going on in that area.
I'm glad you asked that question. I don't think anyone in this field, and it is a somewhat niche field, would say that art is able to heal on its own. We see our work as adjunct to medical care and public health. So the arts in medicine or arts in health sort of conception is definitely in tandem with standard practices in medicine and standard practices in public health. But what we believe, and particularly I believe, is that what the arts does is it engages in a whole nother way. So we're already built through our five senses to see the world and to function and to respond to the world through those senses. So basically, it's taking what we already are wired to do through what we see and hear, how we feel. It's taking what we're wired to do and purposing and using it very specifically for the purpose of engaging and for the purpose of increasing awareness around specific topics. I, for one, do this work around prevailing themes and messages in music and media. And we probably don't have to wonder very long, what are some of those prevailing themes? I've already given a clue: drugs, sex, and rock and roll. Well, that's because those are the themes and messages that seem to resonate with folks, and particularly during the adolescent years. So I, for one, use the arts and music and media to engage these conversations, to engage young people in these conversations about these prevailing themes and messages, and to prompt them through a whole series of intervention work I do, to prompt them to think critically and to really develop their executive functioning skills.
There are, I mean, obviously the media is actually a great, way to reach out to patient population, really, and particularly teenagers. And there are these, Hulu, for example, has this series on the East Los High, where, a lot of these aspect of, of growing up, as a teen in Los Angeles can be very challenging, depicting, a lot of the real life situation that teenagers, go through. I find that the art, in a way, in this way, is a great way to kind of reach out to these people and actually, maybe helpful and engaging, people into looking into that and thinking about that a little more.
Right, absolutely. And here's the real deal, Alan. I think at the end of the day, when we really look at what it is people are paying attention to today, it has a lot to do with media and what it is that folks enjoy the most, even if it's a matter of of escapism, is music and film and what's being presented in film and television and social media. So in many ways, although I began this work in 2005, I actually began this work in school systems then. The fact of the matter is, for a very long time, music has been that universal language that brings people together. And it still can, even in this climate. What we've seen over the years is different genres appeal to different people. That's always been the case. But interestingly enough, the genre of pop music definitely appeals to multiple demographics, but increasingly hip hop has appealed to demographics that are very diverse, and diverse not only in ethnicity but also in socioeconomic status. So what this approach has enabled me to do, that is the approach of using music and media as content and context for a dialogue around the prevailing themes and messages in music, and particularly those that have implications around health outcomes. What this approach has enabled me to do is to be able to have these conversations around race and class, and orientation, ability status, and gender, and to have these conversations that enable young people to um, unpack what it is they see being presented in media and have safe places to process these themes and messages, and then to begin to see the correlation between these themes and messages and their own conduct and their own um, thoughts and their own attitudes and their own beliefs around certain um, behaviors that might actually be fatal, and some certainly can have a negative outcome over the life course.
We have a lot of problem in the healthcare, particularly with the disparity of care. Patients that are or populations that are unable to have access, to healthcare, as well as maybe healthcare that is not really sensitive to their cultural, upbringing, or maybe their geographic, kind of a situation. How is how can we apply arts, to really help bridge the gap in those disparities in healthcare?
Another great question in an area that I feel very strongly about. I think traditional medicine, given its origins and some of the problems that we've had with regard to traditional medicine and the most vulnerable populations, I think there's a reason why people might be suspect of medicine and may not choose to access the healthcare system in this country as we'd like them to. There are real instances where the government and academia have come together and done unethical things. The Tuskegee experiment is one clear example of that. There have been others that I won't get into right now. So I guess the point I'm making is there is a real concern around access to healthcare, particularly around individuals who are already vulnerable, and then who are aware or have been informed of all the different kinds of problems ethically that go on. But the good news is that with arts and health and arts and medicine, when the intention is to reduce the stigma associated with prevention, and when the intention is to intentionally bring about a cultural sensitivity in the delivery of care, this is a very good way to do that. Now, I will say that my particular approach, and the approach that those that I've trained, we're very conscious of the need to be non-judgmental around some of the themes and messages, but to be very clear around which ones align with health and hope versus which ones are hurtful and harmful. So I think that this particular question deserves a little bit more expose. So what we're seeing in my practice is a lot of the music that young people today, again, surprisingly, independent of race and ethnicity, because I've worked in affluent settings as well as abject poverty settings. Interestingly, some of the same themes and messages are appealing to people of various different backgrounds. And unfortunately, those themes, they're prevailing themes across all genres, film, television, social media, as well as music. And I'd like to talk about what they are in just a moment. But interestingly, those themes are appealing to young people regardless of their background. And they're being presented, though, largely by through stereotypes. And so those stereotypes are also worth unpacking. There's so many layers to this work. I think your question, though, was how do we use the arts to kind of get past these barriers? And if it's done correctly, that is with the training and the cultural sensitivity, and frankly, the empathy, if it's done correctly, then what you do is you actually lower a barrier by engaging folks where they are. And doing so in a way that's not judgmental. Again, this is difficult, and I personally struggled with it on the front end of my career in practice. It's very hard not to be harsh when you see literally alcohol, tobacco, and other drugs being presented as a way of coping and as in celebratory kinds of ways, or when you see casual and suggestive sex being the way that some people get to their self-esteem. So it's so many things here to unpack, but what it does allow is over a series of conversations, so that's important to note as well, is it allows young people to examine these themes and messages with a trained facilitator so that at the end of the day, we end up applying a Socratic approach wherein we're asking key questions, which if nothing else are prompting a deeper disparate kind of thinking. One of those 7 executive functions that we care a lot about is cognitive flexibility and inhibitory control. Whereas if you're seeing some of these themes and messages in music and media, without being, necessarily conscious of how it's working, you may end up responding in similar ways, and you're certainly going to be predisposed to see it similarly, unless you have a way to process any kind of discrepant thinking. So at the end of the day, and maybe the long and short answer, is that this is a unique approach, very much intended to appeal to populations that may be predisposed for whatever reason not to access the healthcare system or trust it in the ways that we'd like them to.
Not an easy task for sure, but it seems like it would make sense that arts and health, could really help, engage, people in their regular day of life, as well as get them, get the message across about, what it is, to be, have a healthy life and be able to deal with issues like drug addiction, violence, and all things that can, really be addressed by, taking care of the mental health, particularly as in teenagers, and avoid, alcoholism, and avoid all kinds of, subsequent problems that these addictions, could lead to. And I could see how arts could be very helpful in that area.
And what I want to emphasize, because for the audience that is brand new to the concept and seeing these connections, is that largely arts and health is what we've talked about up to now is really very much around behavior, and behavior is very much connected to mental health and that kind of thing. But one of the things that some of my colleagues in practice have highlighted from their perspective is in the clinical settings is that for the individual who may be inpatient, who's really dealing, let's say, with the terminal illness, and perhaps it has a sort of life trajectory that's not very long or promising, that what the arts and health in that instance is allows them to experience art and express art such that it's a part of their healing process. So instead of it all being cognitive, which is what I've spent a lot of time talking about, the arts and health is really both from the expression perspective as well as the deconstruction perspective. And I've spent a lot of time, because my background is in adolescent mental health and school and community settings around prevention. Again, this is my training. I talk a lot about working memory, cognitive flexibility, inhibitory control, or self-control and self-monitoring. Those are a couple of other words that we could use, because that's a part of the development that we want to encourage for young people. But for adults who also, frankly, could benefit from some of these same emphasis, from the same emphasis, but for them, it could very well be, as well as with kids, it could be a healing experience because they're expressing art. So in the instance of my work, we talk about these prevailing themes and messages. We go through a process of identifying what it is that we see through something we call "Do You See What I See?" And then we tag and talk about what individuals see, and we do that from an intergenerational perspective, because frankly, young people today, unless they've been exposed to other generations and other points of view, frankly, they may not see what another person sees. For instance, one of the prevailing themes in music and media is foul language. And unfortunately, the language that we've seen so often in music and media, mostly around popular music and media, has been so, let's just say, different than what we might want to have our young people learn, that they may not even realize that that's not common language. They've seen over the course of their lifetime, and these would be young people under 20 years old. So now we're talking people who were born in 2020, in 2001. These folks may not have seen anything other than drugs and alcohol be used as ways to cope. So it requires discrepant thinking, meaning points of views that may be different from those that prevail, that then enable them to have at least two different points of view. Then we rely on the facts, not the opinions, because those can be sliced and diced all sorts of different ways. This is where my public health background comes in. We rely on the facts and present the facts as if they matter. But what I found in my practice, Alan, is that some people, young or old, have discarded the facts. So then all of a sudden we're meandering into the space called fake news and social media. And there again, there's lots there to talk about. So what I'm up to with regard to arts and health and arts and mental health is really just having conversations about the impact that the visual, performing arts, media arts can have on the way you think, the way you feel, and subsequently how you respond.
Well, obviously, you've been very active in the last over 20 years now with Here's to Life. Where are we headed in the next 5 to 10 years, Julian? Where's the research leading us to, and how do you think we could integrate more arts in health?
I think we are at a precipice, honestly, Alan, because frankly, what has been going on in school buildings, again, you'll hear me speak a lot about this from this perspective of adolescence, because that's been my specialty. But I'll try to talk a little bit more generally about what's going on beyond just that subpopulation. But for now, I'll use that as an example. And so what we're seeing going on in these school buildings, in addition to everything around instruction, curriculum and instruction that already was a big deal, and everything around what's called student support services, for which mental health would be there. And now, combined with all of that, we're adding to this the whole thing around safety. Well, it just so happens that if we could have conversations about what it is we're being entertained by, and how so much of what we see is violent, aggressive behavior and trauma, if we could have those kind of conversations in safe spaces, we might actually be in a position to unpack some of the attitudes and beliefs and behaviors that are aligned with um, risky behavior, and certainly that might align with violence. And so I think going forward, we're likely going to see more decision makers in school and community settings embracing arts and health. And this is where it's going to get interesting, because when you take a look at what it is young people are digesting, at least through the prism of their selections of what it is they are listening to and which artists they like, I have seen over the many years of practice a particular demographic being portrayed in media, and that's that's where the training comes in, because those stereotypes that are projected are also coming from a particular place. And so then when we look at identity development and values and coping mechanisms and communication norms, all of which are highly impacted by what young people are exposed to in their developmental years. When we look at all of that, there are some stereotypes that we've got to unpack and make sure that the right people are not doing, that the right people are doing this work with the right intentions, but without promoting more stereotypes. And I could say a whole lot more about that. It just requires a lot more scaffolding before I dig into it. But what we don't want is well-intentioned people to actually be promoting the stereotypes that the populations that they're actually serving might become actually more disengaged than engaged. Does that make sense to you?
Yeah, it does.
Yeah, we've got to be real careful that we don't have people who are working with Black and brown kids who may not be themselves from that same demographic, who then use the content and context of music and media that the kids like, and then make them feel in any way less than or marginalized or the subject of this approach. We've got to be very sensitive and culturally sensitive to all that comes with that and where all that comes from. So Music Synergy addresses that, and we do that. That Music Synergy is the name of the intervention, the name of the program. There are all sorts of publications out there under my name, Julian Owens, Dr. Julian Owens for in Music Synergy, MUSICSENERGY, Music Synergy. There'll be sufficient work out there, but we've got to make sure that the individuals who are pulling their hair out, that you asked what's going to be the case going forward. Well, folks are going to be pulling their at everything they possibly can, hopefully evidence-based research as well, but just looking for any sort of way to engage young people and to have them examine their conduct before there's an event.
So, I think this is a very important point, because we have what we treat in the adult population. One of the big pandemic is the obesity, which really starts very early at early age, even in kids and teenagers, and I wish there was a way to really kind of get to these population where we could at least bring about some of the problems related with eating habits and activities and exercise, and in a way, prevent the occurrence of diabetes, hypertension, as well as coronary artery disease, which we treat as adult cardiologists. So, these interventions have got to be, early on, in while the child is in development.
Absolutely. That's really important. I was going to, I'll have to get back to you, I suppose, with the details, but there are some very clear connections between art and medicine, arts and health, and specific health conditions. Stress, anxiety, uh, are two that come to mind, but there's some others I'd like to share with the audience. But again, if there is, like what you just talked about, were health conditions that you probably see in your practice, but what's ancillary to those are the stress or the anxiety or the depression that can come with chronic disease. And so again, through the expression side of arts and health and medicine, um, that's an outlet for folks to, express themselves in ways that may reduce those symptoms that I just mentioned. But again, that's the piece of this work that I have done the least with, although many of the folks that I've worked with over the years have been screened for in school settings, especially around attention deficit or other types of psychosocial, psycho-behavioral concerns that may well not have been diagnosed. But ADD is a biggie, and just the inability to stay on task. It may not have reached the level of a diagnosis, but again, all of this is connected to what it is that young people spend their time doing. So my position early on in this work is, let's just go ahead and go with what it is they're already spending their time doing, and let's repurpose it so that it enables us to have conversations around life skills and conversations around behavioral monitoring that might ultimately be self-monitoring and self-control.
Very important work, Julian. And basically, you're helping shaping the new generation, and hopefully, hearts and health, can be used more to kind of bridge the gap with the determinants of health and patients that have poor health, or they're living in an environment that is not conducive to get access to health, and hopefully arts and health can really reach out to these people.
Absolutely. And what we know in terms of social determinants of health is education and income are invariably very important as social determinants of health. So again, through the public health lens, the earlier the intervention, the better. This is not just implicated for those who, what we might call, are high flyers, that is, individuals who are already experiencing challenges within the school setting. This particular approach around arts and medicine and arts and health, using music and music's energy, is intended to appeal to the general population, but it certainly can be applied to the individuals who are already at higher risk, because many times they are in settings either through their homes or communities or friend group. They're already predisposed to have higher incidence of being exposed to these negative themes through their environment or through their media. And so it already resonates with them. And so it's really been well received by the young people. I did do a study. I've done many studies actually, but the study that launched my work as Dr. Owens shows that young people are highly engaged in this way of teaching and learning and frankly, development. but they stipulate it must be done by individuals with whom they feel comfortable, and it must be done in a way that doesn't demean the artist or the ones that they are attracted to. And again, this puts me right back to what I was saying before. The training to use this approach, this particular approach. Arts and health and arts and medicine, Alan, is just a big idea. So it's these particular approaches, particularly the ones that have been subjected to evaluation studies. These are the ones that we need to focus on, because arts and health by itself can go the wrong way without it being clear what the intentions are, what the outcomes are, and all the lessons that have been learned from those who do this work. And I've seen, for instance, individuals who love the idea and think they can run with it without having the training, and see the very opposite occur. Because if you're using the music and media that they like, and if you're not clear with what your intentions are, or the process to sort of scaffold over time how to deliver these lessons, then you actually could be cultivating the very behavior that you're wishing to reduce. Because who brings the most radical, egregious content into the classroom? That decision alone could be terrible, but you have to know exactly what it is you're doing and why. You probably shouldn't bring in anyone to observe on the very front end until we've established some basic rules. And then by that point, we can have a community conversation or in small groups around what it is we see and why what we see is a concern.
Well, Julian, I really want to thank you for the time that you spent today, Dr. Julian Owens, and his incredible work with Here's to Life, and about shaping our new generation, helping them, resolve some of the ongoing struggle with the daily life, and how we can promote social connection, safe environment, and maybe eliminate some of these health disparities that we have one day.
Absolutely. And if not eliminate them, Alan, we certainly can make folks aware of them before they become their own reality. Too often we see generationally people with bad health pass on bad habits, and then those bad habits result generationally in bad health. We can interrupt that cycle for some. We may not be able to interrupt it for all, but if we can create safe spaces in the community and school that not only just talk about health, and sadly, health in physical education, in many school districts, it's not at all what you'd imagine. But what we've got to do is make more room for the kind of dialogue that requires a connection between the real world and what it is we want our children to learn. Because as long as those two things are different, then the kids are going to choose the thing we don't want them to learn.
Exactly.
To learn more from our team of cardiologists, please visit us at MyHeart.net. You can also follow us on social media by searching MyHeart.net on Facebook and Twitter. And be sure to subscribe to this podcast so you don't miss our next episode.